So today we are going to learn about diuretic drugs. So diuretic drugs means drugs that are acting on the kidney. Okay. So the function of diuretic drugs are which are increase the flow of urine. Okay, these drugs will increase the flow of urine, and it is also used to relieve the edema. Edema means it's a swelling which was occurred by the accumulation of fluids in different parts of the body like hands, legs and ankles. Okay, they are also used for the elimination of toxic products through urine. Okay, these toxic products will also eliminated through urine by using these diuretic drugs. Okay, here this is a classification of diuretics which was based on the mechanism of action, and it is also based on potency. Potency means strength and effectiveness of the drug. Okay, how effective the drug shows its strength. Okay, how strong the drug is capable of being. Okay, how effective it is, that is called a potency. Strength of dose drug. Okay, these are all the drugs based on the mechanism of action. These are all the drugs. First of all, xanthine, Thaizides, acetazolamide, Pilano Lactone, mannitol glycerol isosorbate, trampoline amyloride, furosemide, ethacrynic acid. Okay, here this is the mechanism of action. So here the promoters of the glomerular blood flow. The mechanism of action of xanthines is it promotes the glomerular blood flow, whereas the Thaizides and acetazolamide, it inhibits the tubular reabsorption. Means inhibiting the tubular reabsorption means these tubules will be present in nephron. Reabsorption of what? Sodium, chlorine, potassium, like that. Okay, it inhibits the tubular reabsorption. Next, Pirano Lactone, antagonist of aldosterones. Here the antagonist means a substance that acts against or it block an action. Okay, aldosterone means it is steroid hormone. It was secreted by the adrenal gland. Okay, the antagonist of aldosterone. Next one, mannitol glycerol isosorbate. The mechanism of action is osmotic diuresis. Okay, we know that osmosis means. Okay, osmosis means it's a net movement where the semi-permeable membrane, the movement of water from high concentration to low concentration, that is called osmotic diuresis. Whereas trampoline amyloride, it's a drug. Here the mechanism of action is potassium retaining. Okay, diuretics. Furosemide, ethacrynic acid, it shows its action on the loop of Henle. Diuretics. In nephron there is a part called a loop of Henle, whereas a descending loop of Henle and ascending loop of Henle. So this dose of drug will show their mechanism of action in that part. Okay, we have to remember a nephron also. In that condition only we can know how the drugs shows the mechanism of action towards their different parts based on the potency. See here, this is a drugs, osmotic diuretics, xanthine derivatives, carbonic anhydride inhibitors, Thaizides, furosemide, bumetanide, ethacrynic acid, trampoline amyloride, Pirano Lactone. These are all the drugs. See here the how strong the dose is. So first of all, this osmotic, these are the weak diuretics. Thaizides are the moderate potent diuretics. Furosemide, bumetanide, ethacrynic acid, these are the very potent. Okay, very effective diuretics, means high seeding diuretics. Okay, trampoline amyloride, Pirano Lactone, these are the potassium retaining diuretics. First we have to remember these classification, which we can discuss in clear. Okay, first if we know the drugs, first of all we have to remember the drugs. After remembering, if we know the mechanism of action, where it was showing its mechanism of action, it will be easy. And how strong, how weak these drugs are based on the potency, here it included. Okay, this is all about the diuretics mechanism of action based on mechanism of action and potency. This is all about the classification. Okay, next one we are going to learn in detail about the drugs in further. First of all, we have to learn about the nephron. Why? Because these drugs will act on nephron. these drugs are showing their action on kidney now. In kidney there will be the billion of nephrons are there. So first of all we have to remember once again this nephron diagram. So first of all, this is a glomerulus which was present in Bowman capsule. See, this is like a snake head like structure, so it was a Bowman capsule. Next to one, a proximal convoluted tubule, PCT. Here the renal arteries, it carries oxygenated blood. Renal vein, deoxygenated blood. Next from PCT it was continuous to loop of Henle. I said no, descending limb of loop of Henle, descending limb of loop of Henle, ascending, descending. Next it continues to DCT, distal convoluted tubule, which was opposite to PCT, DCT. Next one only CT, collecting tubule. Okay, this was all about the nephron. Where here what happened, elimination of toxins will be there now. First of all, here some fluid is present, means here the sodium, potassium, chlorine, hydrocarbonates will be there in fluids. Okay, normally what happen in these parts, they will reabsorb that. Okay, here some potassium, chlorine will be reabsorbed, here some sodium, potassium will be reabsorbed, here some water will be reabsorbed, and wastage will be excreted out. This is all about. So this is a kidney longitudinally transverse section. So this is a pyramids, and here it is outer surface, cortex, pelvis. See here arterioles, efferent arterioles are there. So in that we discussed about this nephron. This is all about the nephron. Okay, next one, how this thiazide drug will act on nephron, will show its actions on nephron. First of all, here the chlorothiazide was the first compound that was extremely studied. Okay, and other drugs of these groups like hydrochlorothiazide, hydroflumethiazide, benzoflumethiazide, polythiazide, chlorthalidone. So these all names will be ended with thiazides. Okay, we are learning about the thiazide now. This group of the drugs also will be ended with thiazide only. These are the derivatives of parent compound called a benzothiazine. Okay, we have to remember these drugs. So see here, these are the pharmacological actions. There are three types: diuretic effect, hypotensive effect, metabolic effect. So here these thiazide will show their action at distal tubule. Okay, DT. This is the PT, PCT, DCT. These are the loop of Henle. Okay, so here thiazide will be show action here. Okay, how means here there is a lot of sodium is there. Here in this condition, sodium chloride is there, water is there, hydrogen chloride, hydrogen carbonate is there, okay, bicarbonates are present here. Bicarbonates are present here. So these thiazides will be acted directly on the renal tubule. Okay, they prevent the absorption of sodium and chlorine. The rate of glomerular filtration, this glomerular filtration will not affect. But what happened? It was not modified by the acidosis and alkalosis. So here there will be a weak inhibition of hydrogen carbonate. Okay, hydrocarbonate is also weak inhibition only. Here the sodium reabsorption was more. Here the potassium is also present, sodium is also present, but here in DT there will be a lot of sodium. Okay, this sodium will be exchanged with potassium. So what happened? There will be the loss of potassium. Why? Because there is a lot of sodium, here the less potassium. By exchanging, what happened? Here the sodium will increase, whereas potassium will be decreases. There is a loss of sodium and potassium. Okay, and chlorine is also lost because they prevent the reabsorption of sodium and chlorine. So then in this condition what will happen means it leads to the hyponatremia, means hypo means low, decreases the natremia means sodium, hypokalemia means low potassium, hypochloremia means low chlorine reabsorption. So these will produce what happens, so all decreases that's why they produce the hypokalemic, hypochloremic alkalosis. Alkalosis means alkaline. Okay, it produces these hypokalemic, hypochloremic alkalosis. So in this condition this will happen at DT. Okay, these thiazides show a pharmacological effect, diuretic effect at DT. Next one, hypotensive effect. Hypotensive effect, what happened? These Thayzides produce a mild hypotensive effect. It shows a mild hypotensive effect. Means hypo means low. Okay, and also effects on the sodium metabolism. Okay, direct effect on blood vessels. Like this, these Thayzides will show its pharmacological action. And the metabolic effect means the prolonged use of these Thayzides, what happened? It causes to hyperglycemia. Hyper means high, glycemia means glucose in the bloodstream. Next, it also causes the glycosuria. Means what happened? Due to the inhibition of insulin release, decrease the secretion of uric acid, increase uric acid concentration in plasma. Okay, this will all effects was shown by the Thayzides. Next, normally Thayzide function, diuretic function is what? To increase the urine. But what happened in diabetic insipidus, these Thayzides will decrease the urine value. Okay, it opposite, the function was decreasing here. So we have to consult the doctor. According to that, they will prescribe the drugs. Okay, this is all about the Thayzides. Okay, normally it shows the action in DD, distal convoluted tubule, where the sodium, potassium, chlorine, hypocarbonate will be present. Okay, the sodium reabsorption will be more. Okay, the exchange of sodium and chlorine, potassium will be happen. That's why what happened here, the potassium level will be decreases. That's why it produces the hypokalemic, hypochloremic alkalosis. Okay, these are all about the effects of Thayzides. So for the next one, we have going to learn about the route of administration, oral route of administration. It shows the effect within 1 hour. Excretion as usual by kidneys, by tubular secretion. Adverse reactions like hypokalemic, hypochloremic, alkalosis, weakness, muscle weakness due to fluid loss. Why? Because here the sodium is also lost. Sodium, chlorine, potassium loss will be happen. So next, blood dyscrasis means here the disorder and disease of the bloods like thrombocytopenia and rarely allergic reactions. Here next one, dosage, chlorthalidide tablet dose may be from 500 to 1000 mg by oral route of administration, whereas hydrochlorothiazide, hydroflumethiazide route of administration is oral route only, but dose is 25 to 200 mg. Okay, next one, uses of the Thayzides. So this Thayzide drug will be used to treat the edema. Edema means we know that fluid accumulation associated with the congestive heart failure, with liver and renal failure. Okay, it is also used to treat a sodium retention, hypertension, renal disease, liver disease, glaucoma. Glaucoma means what? Glaucoma means the nerves which was connecting to eye or a brain will be damaged. High eye pressure, because of high eye pressure, this will cause. Next one, raised intracranial pressure of cranium. Okay, this is a Thayzides uses. Okay, in this condition, this Thayzide drug will be used. This is all about the Thayzide drug. Next, furosemide, furosemide also same, Lasix also same. Lasix in the type of injection, it will be we can see in IV route also it will be taken, this drug, and also it will be effective in oral route also. Structurally similar to the Thayzide drug. Okay, here the mechanism of action will be occurred at PCT. Okay, whereas a Thayzide's mechanism of action will be, it shows a pharmacological effect at DCT, but here this furosemide shows its effect, pharmacological effect, mechanism of action at PCT. So what happened? It inhibits the reabsorption of sodium and at PCT and ascending loop of Henle. So this is a ascending loop of Henle. It is also loss of chlorine is more than the sodium. In here there will be the chlorine loss will be more when compared to the sodium. Here the sodium is lost now. In Thayzide condition, sodium is lost, but here the chlorine is more less when compared to the sodium, and it enhances the potassium excretion also, but no loss of bicarbonate. Here the weak inhibition of bicarbonate, but here the no loss of bicarbonate. So it produces the hypochloremic, hypokalemic alkalosis. Okay, So this starts its effect in 1 hour and it completes within 6 hours. This drug effects. Okay. Next, absorption, fate, excretion. Here the route of administration is also there, IV route also there. But the route of administration, it excretes unchanged within 4 hours. It is a quick and short duration of time. Whereas the IV route, it starts within 2 minutes. Okay, means super fast. It affects complete in 2 to 3 hours. But adverse drug reactions, what happen in IV route, it may cause a cardio arrest. Okay, in IV administration, cardio arrest, maybe in some conditions adverse reactions will happen. Muscle weakness, okay, cramps due to electrolyte loss, but because here see chlorine is also lost, potassium bicarbonate is also lost, all these electrolytes will be lost, so that's why may cause nausea, diarrhea, liver, bone marrow changes will be occur. This is all about the furosemide, which shows its mechanism of action at PCT, proximal convoluted tubule. So we have to remember what in which part what secretion was going on, what loss is going on, what reabsorption will be going on. We have to remember this. Okay. Next one, bumetanide. Bumetanide is also similar to the furosemide, but 40 times more potent. Means it is 40 times more effective. It produces a very rapid diuresis. It acts in case not responding to the furosemide. Means in some people what happened, furosemide may not show its mechanism of action. In that condition, the doctor may prescribe the bumetanide. Okay, and also it causes a hyperuricemia. Means hyperuricemia means high uric acid. Potassium loss will occur. Ototoxicity means it develops the hearing balance problem due to medication. In some conditions what happen, because using all these medicines they may cause effect to these hearing problems. So these are the adverse reactions. Next drug is torsamay. It is another high ceiling diuretics, means high potent diuretics. Action similar to furosemide, but it's 3 times more potent. Okay, while comparing to the furosemide drug, this torsamay drug is 3 times more potent, 3 times more effective. Okay, duration of action is slightly longer period of action, but it is useful in edema. Edema means we know that accumulation, fluid accumulation, and also hypertension. In hypertension also this drug will be used, torsamide. Next, Pilano Lactone. It was a potassium sparing Pirano Lactone is there. Pirano Lactone, it is a steroid. It was having a structural similarity to aldosterone. Okay, it is a aldosterone antagonist also, and it is a steroid also, and it acts by competitive antagonism. Competitive antagonism means what? Means it binds the same recognition site on receptor. Two will be there. Competition will be occurred between the 2 drugs. Okay, to bind to the same receptor. Okay, and it decreases the elimination of potassium. Spironolactone is ineffective in edema as associated with rise to aldosterone concentration, and this diuretic effect of spironolactone develops slowly, so it combined with other diuretics like Thaizides. Okay, so it decreases the elimination of potassium. It is so it is not effective, it is slow. That's why this drug is slow. That's why it combined with other drugs like Thaizides to show its mechanism of action effectively. This is ineffective in edema, not associated in rise with aldosterone concentration. This is all about the spironolactone, Aldosterones. So it is a steroid drug. Okay. Adverse reactions like nausea, drowsiness, hirsutism means excess male hormones called androgens will be increases. Okay, gynecomastia means that uneven hair growth will be occurring in men. Okay, in different parts of the body, throughout the body also. Next one, vomiting. Dose we will use for the spironolactone 25 mg 2 to 4 times a day by the oral route of administration. Okay, this will show this effect on DT, distal tubule. Okay, spironolactone. It shows its effect at distal tubule, distal convoluted tubule. Next one is Osmotic Diuresis. Here the drugs included in these Osmotic Diuresis is isosorbate, mannitol, glycerol. Okay, these are the drugs. So what is the mechanism of action of these drugs? Means by increasing the plasma concentration of these substance, the concentration in the glomerular filtrate can be increases. Here this concentration of plasma will be increases. That's why the glomerular filtration will also increase. Due to this osmotic activity, the reabsorption will be opposite. Okay, they produce the diuresis, and in this condition there will be more elimination of water when compared to the sodium, okay, than the sodium. In other drugs, what happened by the using of the other drugs like furosemide and thiazide, there will be the loss of sodium, potassium, chlorine, bicarbonate. But in this osmotic condition, there will be the elimination of water comparing to the sodium. So here the mannitol use is to treat increase the intracranial interocular tensions in cranium. Okay. Here there will be the fluid which is called meninges in the cranium. So it will treat there. Okay. Next one, trampoline. It is a potential trampoline. It was a drug of diuretics. It is a potassium retaining diuresis. It is a non-steroid compound, but it is not also powerful. It is used along with other drugs. Okay, simple. Route of administration is oral route, and mechanism here the reabsorption of sodium chloride and bicarbonate, but it decreases the renal excretion of potassium due to inhibition of its secretion in distal nephron. This will be occur at distal nephron, means distal convoluted tubule. Okay, what happened here, the reabsorption of sodium chloride will be occur bicarbonate, and it decreases the renal excretion of potassium. Why? Because the sodium will be exchanged with potassium now. So by this, here the sodium will be more in distal convoluted tubule well compared to the potassium. So what happened, it will be exchanged. By the exchange, there will be the complete loss of potassium. So this will occur at distal convoluted tubule. So next, adverse drug reactions. Adverse drug reactions of trampoline is hypercalcemia. Hyperkalemia means high potassium, vomiting, diarrhea, skin rashes, dryness of mouth. These are all the adverse drug reactions of the drug. The route of administration is oral route only, 100 to 200 mg. It is a weak diuretic, so it is not usually recommended. Okay. Next one, important one, amyloid drug. So it is a potassium retaining, potassium sparing retaining diuretic like trampoline. It is like a trampoline drug only, but this amyloid was 10 times more potent than trampoline. This is above drug. Duration of action is longer than trampoline. Okay, 10 times faster, but it takes time. Okay, it's a potassium retaining diuretics. Mechanism is it decreases the calcium excretion but increases the uric acid excretion. So can be given with thiazides or fusimides. These drugs will be combination drug. It will be given, but it increases the uric acid. Okay, hypochloremia, or it decreases the calcium excretion. Adverse drug reactions like nausea, diarrhea, headache will be occur. Dose is 10 to 20 mg daily. So see here, this was easy to understand. This is a nephron. See in here, proximal convoluted tubule. Proximal convoluted tubule will act carbonic anhydride. Here the sodium hydrogen exchange was blocked by the carbonic anhydride inhibitors. Okay. Loop of Henle. In loop, what happened here, the sodium potassium to chloride co-transport will happen. This was blocked by loop diuretics. Distal convoluted tubule, fourth here, sodium hydrogen exchange will be happen. Fifth one, thiazides diuretics, sodium chlorine co-transport was blocked. Here the sodium potassium reabsorption was blocked by potassium sparing diuretics. So in these sites, these drugs will show their mechanism of action. This is easy flow, easy to understand. Here also is there, see, this is the nephron, renal corpus. It generates the glomerular filter composed by water, ion and small molecules. This is a proximal convoluted tubule where the reabsorption of sodium, chloride, potassium, water, glucose, amino acids, bicarbonate, calcium, potassium, and it secretes the ammonia and creatinine. Loop of Henle reabsorb the water, sodium and chlorine, reabsorb ammonia and sodium chloride. Here the reabsorption of sodium chloride water and secrete the ammonium, hydrogen ions and potassium, reabsorption of sodium and chloride. So what happened here, this by using these drugs, what happened, the reabsorption will be occur. So this will be easy to understand. If we remember these flowcharts, we can completely, it will be easy to write exams. This is all about diuretics. First of all, in diuretics we have to learn about a classification of diuretics based on mechanism of action and potency. Here only two topics are completed, and we have to remember the nephron diagram. We have to draw a nephron diagram on which side the drugs will show their action and in where the reabsorption of sodium, potassium, chlorine and calcium was happening, where it was excreting. These points should be remembered, so that's why it will be easy. At last slide I have included that now. If you remember that also, it will be easy. So this diuretics is all about to increase the flow of urine and relief of edema and to eliminate the toxic products. So simple. Thank you. Hope you understand.